Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
We are excited to welcome Dr. Michael Ruscio, a doctor, clinical researcher, and best-selling author with a focus on integrative and functional medicine. Welcome.
Hi, thanks for having me.
So you have a personal health experience you would like to share with us.
I do. My initial goal was to go into orthopedic medicine, and in college I had a personal experience that kind of opened my eyes to other areas of study. I didn't know why, but I was having pretty terrible insomnia, brain fog, depression, and it turns out what was driving that was actually a parasitic infection. Now, I thought I had adrenal fatigue, hypothyroid, heavy metals. I went through the gamut of the natural and functional treatments, and nothing really vectored substantial benefit. What was paradoxical was there was no gas, bloating, diarrhea, abdominal pain that you would expect to accompany a parasitic infection. There was only this crippling insomnia, brain fog, and fatigue. And eventually, thankfully, I found a functional medicine doctor. He diagnosed the problem. I thought he was nuts at first, to tell you the truth. When he proposed a parasite as potentially being the cause, I remember thinking, this guy's nuts. But I had nothing really to lose at that point. I'd seen my GP, an internist, and an endocrinologist, and they all did their workups and said, no, you look fine. And so that opened my eyes to two things. One, if you treat not the cause, then the likelihood of getting a response is almost zero. And you can have non-digestive symptoms, in my case insomnia, brain fog, and fatigue, as the sole manifestations of a problem in the gut. So I diverted my path into natural medicine and really focused on the gut, and it's been a very fruitful area of study because now we're learning that so many things can tie back to the gut. Gut brain, gut joint, gut skin, and that's something I'm very passionate about now, is helping people put those pieces together.
So your website states that you're working to ensure that alternative medicine is more affordable, effective, and practical. Will you share on how you and other clinicians can work to make alternative medicine more accessible and affordable to a broader range of population?
Absolutely. This is such an important question because as we're evolving the field of natural medicine, we should become more efficient. Or like anything else. Look at a cell phone 10 years ago compared to now. Half the size, well, some cell phones are huge, but generally speaking, a smaller size with way more computational power. So we should see healthcare in natural and functional medicine become more efficient. One of the things that's holding the model back is this thinking, this false thinking I would claim, that more testing equals better results. And that tends not to be true. In fact, I would go as far to argue that more testing can actually detract from outcomes because now you have way more data than you need, and if we're being fully honest, many of the labs have not yet been validated that we're using in functional medicine, so at best they're speculative. So we have an overwhelming amount of data, none of all which is relevant, but we end up treating some of the irrelevant data, and of course that leads to ineffective treatments. So the model I'm trying to pioneer is focusing on really the most root, fundamental, and also scientifically validated tests. And unsurprisingly, when you do that, you can actually achieve better patient outcomes and do that in less time and with less money.
You are careful to balance a natural medicine approach with your more conservative and traditional practice. Will you provide us with an anecdote on how this is practiced within your?
Sure, yeah. And yeah, I think this is something hopefully more and more people are becoming privy to, but we don't have to confront a patient with a us or them sort of mentality. In fact, I would argue that the best way for natural medicine to reach and to help more people is to try to disseminate more broadly and also try to integrate and collaborate with conventional medicine when we can. And also understand that no one provider is going to be able to know everything nor help every problem. And as a specific example, I never discourage my patients from following up with their gastroenterologist. If they want to be seen, I'll routinely tell them, yep, do your follow-up because they are looking at different things. They might be looking at family history and symptoms and trying to fit you into what the appropriate screening interval is for colorectal cancer, which I am not doing. right? I'm privy on the dietary research, probiotic research, herbal research, what we can do to kind of functionally and naturally work with your gut. Whereas many gastros aren't privy on the nuances of a low FODMAP diet, or let's say a low histamine diet, or probiotics, nor would I expect them to, right? So it's also unfair to expect a conventional gastroenterologist to know everything about natural medicine. So I think we should not put all the culpability on the conventional doctor also, but rather let's have one good provider on each side of the fence, your more natural or functional provider, and your conventional provider, with a mutual respect, realize that we have overlap, but also distinct areas of separation, and we should be working together to give the patient all the options that they need to be as healthy as they can.
Mm-hmm. So when did you first discover A4M?
Boy, I discovered A4M, I believe actually, while I was still an undergraduate in college. I was a pretty voracious learner, and I came across some of the lectures on testosterone with Ronald Rothenberg. And, you know, I was very interested in hormonal optimization, as many young guys are. And so he really opened my eyes to the importance of testosterone for male health, kind of helped to combat some of the, what seemed to be overzealous anti-testosterone camp. And opened my eyes to how important female hormones can be. You know, I didn't really realize how important hormones were at that point in time. I was so early in my career. And that was kind of a gateway to a number of other things, you know, eventually peptides and growth hormone and all these other things. But yeah, way back even in college is when I had my first kind of toe dip into the A4M pool.
From your experience with A4M, what would you say was the one thing that you learned that had the biggest impact on the way that you approach patient care?
Kind of great question. There's several, so it's hard to maybe consolidate it down to one. I think more recently, some of the research on peptides I have found to be quite insightful, and some of the work from Dr. William Seeds has been, I think, really enlightening. Earlier in my career, I think the understanding for women and the importance of female hormone balance and how overlooked that can be, and how many of the symptoms women are complaining about, the PMS rage and the brain fog and the insomnia, have ways to be treated that don't require necessarily birth control or you know, high dose HRT, but there's some kind of subtle supports that we can use to really help to resolve some of these symptoms.
You are an author.
I am. I've written one book to date, and I have 2 peer-reviewed papers published. Most recently, actually, I'm very proud of this paper entitled "Is SIBO a Real Condition?" Is really a review of small intestinal bacterial overgrowth published in Alternative Therapies in Health and Medicine. And we really go through the controversies of SIBO. In fact, just in the hallway, I had someone who said they wanted to refer me a chronic GI case. And she said, I'm concerned because she has SIBO, but she's told that she should not use probiotics, which is really unfortunate and disheartening, because we now have to date 5 clinical trials, 1 meta-analysis summarizing those clinical trials, showing that probiotics can be helpful for those with SIBO, and even so far as to have 1 study in a group of IBS patients, and half had SIBO, half did not, and they were all given probiotics. The half that had IBS and SIBO saw better symptomatic improvement from the probiotic than the IBS without SIBO. So a little bit tangential from your original question. But the reason why I'm proud of that paper is because we lay out the evidence in a I guess, dogmatic way. The dogma here would be the mechanism is if we have too much bacteria in the small intestine, don't give bacteria as probiotics. However, many times mechanisms are wrong, right? We speculate from a mechanism. What will happen clinically is based upon this mechanism. However, when we look at the interventional outcome data as in accordance with the evidence-based pyramid, we now treat patients with bacteria probiotic who have overgrowth, and surprise, surprise, they actually get better. And this is because we of course know that probiotics secrete antimicrobial peptides, and so probiotics are actually in part antimicrobial. So this is why it's so important to look at levels of evidence and not to extract treatment recommendations from a mechanism, but rather say, okay, now we've tested the mechanism, and here are the outcomes in the real world with patient interventional trials. And so, yeah, 1 book, another probably soon on thyroid health, because there's a lot of confusion regarding thyroid, as I spoke about today, and then 2 papers and hopefully a number of more papers in the next year or 2.
Tell us about your book.
Healthy Gut, Healthy You is my book, and this was a significant undertaking. 3 years to write it, and I did not write this book as just a few thoughts and theories. There's just about 1,000 references in that book, and these are mostly clinical trial references or above, meaning systematic reviews and meta-analyses. And we give the reader a narrative on gut health that's both progressive on the one hand, but also a bit conservative on the other. Using gluten as one quick example, there's definitely overzealousness regarding gluten, and that actually harms people because some people have problems with other foods, FODMAPs, dairy, histamines, let's say. And by inculcating someone into thinking that they have to avoid every food that could be a problem for them, we make their dietary world very narrow and their life very hard. So we cover the evidence regarding gluten. Probably the best research from Volta at the University of Bologna has found about a 3% prevalence of non-celiac gluten sensitivity. And this is probably the best data done to date, 12,000 patients. So that's one example of giving people a responsible narrative on gluten, not putting all of our eggs in the dietary basket, and then we lay out other therapeutic options. As an example, we have a good narrative on probiotics, what they can help, what they can't help, how to use them. So we try to find that nuance and that balance with diet. But of course, there's more to gut health than diet. And this is, I think, another important concept, which is sometimes we try to force a dietary solution to what might be a non-dietary problem. And being able to adjudicate when it's time to move out of the dietary camp into other therapies is important. Because if we push people to the most uber restrictive diet, then that can make their life unnecessarily hard. So there's a point at which we have to say, okay, we're not getting the result we need from the diet. Let's not go more restrictive with the diet. Let's leave that essentially where it is and move off to other therapies. And these therapies are laid out in a hierarchy, meaning here is the second line of therapy you should consider, and if that helps them, you kind of go out to maintenance, and if it doesn't help them, you keep working through the clinical algorithm, which of course is based on research, one of those of which is probiotics, like we talked about, very much so misunderstood. But we certainly go beyond probiotics. We discuss antimicrobial therapy. We even discuss elemental dieting, which is a pre-digested hypoallergenic meal replacement, which is, I think, vastly underreported in terms of how helpful it can be. But certainly for these chronic cases that don't seem to be able to improve, something like a liquid meal replacement diet for a short term can help quell inflammation, and almost we could term this kind of reset the gut by allowing a chance off of hard foods. The gut has a chance to rest, repair, rebalance. So yeah, I mean, there's a lot in the book there, but why I'm so proud of it is it's a very evidence-based, but also not evidence-limited. So we're thinking progressively, but also cautiously. We give a responsible narrative about food, so we don't scare people. We try to empower people in the book. And then there's a really solid, personalizable treatment algorithm so that someone can, I don't want to say choose their own adventure, but they can take one step, and then at the end of every step we do a symptomatic reevaluation. And then depending on their symptoms, they either kind of keep working through deeper steps of the protocol or they go into maintenance. And it makes me very happy to be able to say that there's been a number of reports now of patients who've seen 3, 4, 5, even alternative medicine doctors, functional medicine doctors, to no avail, and they discovered Healthy Gut, Healthy You, and within a few months they were able to finally resolve all their symptoms. So it's not a book that is short on actionables. It's actually quite robust.
Well, good luck with that.
Thank you.
Yeah. And thank you for joining us today.
Yeah, it's been a pleasure. Thank you very much.